So there's a few different barriers to getting specialist input on patients. One of the biggest barriers is the wait time to see the specialists. There is a national shortage of pediatric subspecialists that we anticipate is only going to become worse. They are all really busy, and it can be months before a patient can get in to see them in person. Another barrier is travel. Where we are, it can be 30 to 40 minutes drive to where the subspecialists have their offices. And then once you get there, parking is a disaster. So it's a dissatisfier for patients to have to drive and then figure out parking. Even if it's a 30-minute appointment, it's going to take 3 hours of your day. And so that's tough for families to take more time off work and maybe find childcare for other kids. All those inconveniences become barriers to getting actual input from the subspecialist.
When I receive an e-consult, it's a sign that I can help benefit a kiddo in our community. So a primary care provider, whether it's a pediatrician or a family medicine provider, has sent an electronic message with a very specific question, how I might be able to help them take care of their patient with information that's just available in the chart and what they provide to me in the consult. What I see the benefit of e-consult and coordinated care, it really allows providers to give subspecialty care in that medical home, in that community where those folks live, rather than waiting on really long referral times for questions that could be answered quickly. And it allows us to really target those in-person visits for folks that are going to benefit most from it. And that way, children can get much more quick feedback on that subspecialty care and get guidance without having to have really long wait times to get that information.
The workflow for e-consults within our electronic medical record is super easy. I just search in the order search field for e-consult, and I'll say, for example, dermatology. So I search e-consult dermatology. It pops up, ambulatory e-consult to pediatric dermatology. I select it. It asks me what my clinical question is, and it gives me a field to put a little bit of background, and I sign it. And then within 2 days, I will have an answer in my inbox from one of the dermatologists. The really cool thing about e-consults at MUSC is that we have a lot of our specialists participating. We have pediatric dermatology, pediatric pulmonary, developmental pediatrics, hematology oncology, endocrine, infectious disease, and we are hoping to soon have rheumatology and adolescent medicine.
When you think about where pediatric subspecialists are in most states, they're usually in our larger cities. And we know full well that that's not where everybody lives in a state. And so I view e-consults as a way to provide more equitable access to subspecialty care, especially for problems that might not necessarily require an in-person visit.